Collapsing onto the floor with a back spasm or finding someone on the floor who's collapsed with a back spasm can be quite a distressing situation to find yourself in. So I've just created this video for you to give you some first aid tips to help you get through that situation, to manage it and just know what to do in that moment. So the first thing to understand about a spasm is, if you've watched my previous video on what is a spasm, you'll understand how you get to a spasm. But when you're actually in a spasm, you're in what we call a pain, spasm, pain cycle. So your muscles have gone into spasm, that makes them hurt. Pain makes the muscles spasm even more. The spasm increases the pain, and you're in this cycle. So if you want to help someone or help yourself in a spasm, you need to what we call break the spasm. The way you break the spasm is you either reduce the pain or you relax the muscles. So the very first thing you can do to break that pain, spasm, pain cycle is to give someone some simple painkillers, just a couple of painkillers. That's the number one top tip. Now the rest of the techniques I'm going to teach you now are to help you reduce the muscular spasm, reduce the tension so that we can try and break it. When you find someone on the floor with a back spasm, you won't know why they're in spasm. You won't know if it's a disc injury, you won't know if it's a kidney infection, and you won't know if it's just stress-related muscular pain. So the first and most useful thing you can do for them in that situation is to get them into a comfortable position so that they will at least relax. The minute you get them to relax, the muscle tension will start to reduce. So that's the best thing you can do. So be aware that your friend is terrified, absolutely terrified. Moving even 1 millimeter or 1 centimeter causes the most excruciating pain. So have a lot of patience and just be prepared to spend about 10 or 15 minutes getting them into a comfortable position. So whatever position you find them in, just grab a load of pillows, a load of cushions, and just get them to gently crawl forward onto these cushions. That's it. They will scream, they will yelp, and they will be very, very scared. But do by hook or by crook, just get them to come into a lying position. The reason being that your muscles are in spasm because they're trying to support your body. The minute you become horizontal, the muscles can relax. Here we go. Really nice thing to do is to pop the knee, a couple of cushions under the knee. That just brings the back into a much more balanced position and helps the muscles to relax. Now when the muscles start to relax because they're not holding you up, the pain will start to reduce and you start to address that pain, spasm, pain cycle. Once your friend is in a comfortable position, the next best thing that you can do for them is to use what we call hydrotherapy. It's a naturopathic technique. It's the application of heat and cold alternately to activate what we call the relaxation response in the muscle. When you put heat on a muscle, the blood vessels expand. When you put cold on a muscle, the blood vessels contract. When you do it alternately, hot, cold, hot, cold, hot, cold for specific time periods, you will find the muscles start to relax. Now, you can use a hot water bottle for the heat, and this is an ice pack which you get from a chemist, so you put it in the freezer, it goes hard. You can also use a packet of peas in an emergency. What you mustn't do is put directly on the skin, because you will get you'll get ice burn and you'll get heat burn. So you need to either cover your ice pack with a tea towel or a pillow cloth, or you can put it over a t-shirt. She's okay here, she has a t-shirt, so you decide. Okay, so you start with the heat, 3 minutes hot, and time it. It's very important that you do it for the right times. 3 minutes with heat, 3 minutes with cold. Just over the area of spasm. If it's the whole back, then you can just put the heat over the whole back. So you always start with heat, and you always end in cold. That's your rule of thumb. 3 times. 3 minutes hot, 1 minute cold, 3 times. Ending cold. You can do that as much as you like. The more you do it, the more relaxation response you'll get through the muscles. So once you've given your friend some painkillers and you've got them into a comfortable position and you've done your hot and cold, you should find by now the muscles are starting to soften and relax. They're not so like concrete, and you can start to maybe do a little bit of massage on them. Deep tissue. It's what we call neuromuscular technique, where you actually put such a deep pressure through the muscles that you inhibit the nerve supply to the muscles, and it causes the muscles to start to relax. And that's a very easy and simple technique you can do. depending on how much pain your friend is in, obviously don't put too much pressure through, but just gentle massage will improve and continue your attempts to reduce that spasm. So you can use anything. You can use oil, or you can use aqueous cream. A lovely one to use is something called arnica, which does draw the blood into the muscles, and something that will reduce spasm. There's a lot of essential oils that are very good at reducing spasm. Myself, I am currently manufacturing a cream for this particular purpose, which has pain relief, anti-inflammatory and anti-spasm, more importantly. So you just find something that works for you. So just gently, while your friend's in their pain-free position, you just roll up their top. Just expose the area that's in spasm. It will be very clear to you which area is in spasm because it will feel like concrete. So you just take a little bit of cream, or depending what you're using, with my cream I slap it on because the active properties themselves are really important, and the more you put on, the more response you'll get through the muscle. So just gently, start gently by just smothering the cream on. And once it's on, this is a really good technique you can use. You get your thumbs either side of the spine, never on the spine, either side of the spine, and you just start at the base, just deep pressure up either side of the spine. Your friend may actually be so numb that they can't feel it by now. If a muscle's in a lot of pain, a lot of spasm, sometimes it's just numb, and it will feel like you're not doing anything, but you really, really are. You're starting to relax off the nerves and relax off the muscle. So that's one technique. Thumbs either side of the spine, deep pressure in that big erector spinae either side. Another one I use is you can use your fists here like this, and you can just move that fist up along the muscle there. Okay, that's another one. Very, very effective. And then another simple one, if your friend actually won't let you expose their back and they won't let you put cream on them, people can be very, very sensitive at these times, so don't take anything personally, just go with whatever they'll allow you to do. So you can just use the heel of your hand and just do some really gentle or firm rubbing over the muscles, just to start to relax the muscles off. There is a massive, massive, massive connection between stress, mental stress, and fear and tension levels. So if you can bring someone's fear down, and just by rubbing their back and making them feel a little bit safe, like they're not on their own, that it is going to be okay, just talk to them, that will trigger a relaxation response in the brain that will also start to release the muscle spasm. Last but not least, and it's not a joke, give them a cup of tea or a drink that they really enjoy. Not coffee, but a cup of tea or something that will relax them. It's really, really important to do everything you can to make them feel secure, to make them feel nurtured, to make them feel safe, and to relax them. And a cup of tea is the best way. Now, obviously you can't get them to drink it, so just get a straw, get a half a cup of tea, get a straw, and just hold it up for them to drink. It's amazing the effect of the right nourishment will have on the relaxation of back muscles. For the majority of back spasms that you will come across, the techniques that I've shown you in this video will have a dramatic effect on reducing that spasm. However, there are occasions where you may find that it doesn't have any effect at all. An example of this is a home visit I did recently to someone who I walked in, they were collapsed on the floor with a back spasm. I did all the techniques I've shown you and more osteopathic releases. The minute I tried to get her on her feet, she went into complete spasm again. In that situation, I realized that it was most likely a disc bulge causing her problem. So I called her doctor and we got her some diazepam. Diazepam is an anti-spasm medication which can only be prescribed by your GP. So we gave her the diazepam. It takes a couple of hours to kick in and take effect. And then I did all these techniques. Then we were in business and we started to get somewhere. We had her scanned and she had 3 disc bulges. So it's only really in those very, very extreme situations that you may find these techniques not as effective. But like I said, that's the rare ones that you'll come across. More likely it's just a basic, fundamental, high level of muscle tension in the back that will respond very well to these techniques.